The number of cases in New York is skyrocketing, and it is now the epicenter of the virus in the U.S. The next few weeks are critical, with thousands of lives at stake. What can be done? What must be done? And the pandemic has now reached every country in Latin America, as many are struggling with poverty and lack sufficient medical resources in the region. How will they be able to put up a fight against the virus? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Xin. The state of New York has become the epicenter of the coronavirus outbreak in the United States. Nearly 60,000 cases have been identified, of which more than half are in New York City. Amidst a crisis quickly spiraling out of control, New York Governor Andrew Cuomo hit back at a vague Trump proposal that the region be sealed off, an idea that would, quote, paralyze the financial sector. In an attempt to mitigate such economic paralysis, the Trump administration on Friday signed a $2.2 trillion relief package, the largest in U.S. history, briefly sparking a rally on Wall Street. But while investors appear temporarily satisfied by prospects of government relief, continued market turbulence and a prolonged global recession appear almost guaranteed. What does all this mean for the average household in America? Can the hardest hit U.S. regions expect some measure of containment? And as virus cases in China dwindle, how will the restoration of normal economic and social order, as described by Chinese officials, play out? I'm pleased to be joined via Skype in New York City by Max Wolff, chief economist at the iCash Group, and on the phone in Beijing by Zhao Hai, a research fellow at the Chinese Academy of Social Sciences. Gentlemen, welcome to the show. Let me start with our friend in New York. Now, New York Times reported on Friday that the New York metro area is on track to suffer a worse outbreak than Wuhan, the Chinese epicenter used to be, or Italy's Lombardy region. On Sunday, New York City Mayor Bill de Blasio said the worst is yet to come. So, Max, if I were to ask you, which word would you use to describe the sentiment among the New Yorkers at this moment? What would you use?
I'd say there's a sort of mix of emotion. I think the shock is probably the biggest word I'd start with. I think there's a sense in the U.S. about everything to do with our mostly completely absent federal government response, that this can't be happening to us. This is the kind of thing that I think a lot of Americans would expect to be donating money to if it were happening in another country. And there was certainly no preparation from our federal government leading up to this. There was a lot of misinformation and denial. Then it started, and we've actually been in a super lockdown crisis for 3 weeks at least in New York, begging for resources, and the federal government either denies the problem, doesn't do the resources, or says they will and then doesn't deliver the resources. So I think shock and disappointment would be the kind of unfortunately bitter mix in most people's mouths right now here.
Well, I know that there has been a lot of criticism on the level of the federal government and how they handle the crisis so far. But on the other hand, there are also people who are saying, what about the state of New York? I mean, the governor has been out giving daily press conferences demanding help from the federal government. But what about on the state level? I mean, they were equally available to the information coming out of China, and yet it seems that on the state level, they didn't take up preparedness at the early stage either. Max, what would you say to that?
So there were obviously mistakes made all over the place. Although I think the governor of New York, Andrew Cuomo, is functioning as the president of the United States, at least for people in this region. And while there were no doubt some serious mistakes, including just a lack of public health infrastructure, which is a long and serious problem here in the U.S. and New York as well, he's done so much better than the federal government with so much less resources that it's certainly, there's plenty of room for critique, but I think unfortunately this has turned into a partisan battle here about Democrats and Republicans coming into the November elections, when it really should just be a battle to save lives. And at least, if a bit late, the governor has thrown himself into that battle. He's done what he said he'd do. He's told us the news, good or bad. And most people, I think, in New York State and around New York State deeply respect that he is functioning as though he were the president, because the president of the United States is simply not doing that.
On the city level, Mayor Bill de Blasio said on Monday that they're setting up a field hospital in Central Park. So this is amidst reports that medical supplies, particularly ventilators, are running dangerously low. So how are situations looking in the week ahead in terms of the capacity to deal with the severity of this outbreak? We were hearing this shocking description by President Trump of how bodies were lining up into these freezer trucks, that these trucks was as long as the Rose Garden in the White House. So any glimpse of hope on that front, Max?
I think it's going to get a lot worse before it gets better. I think that's the consensus of all the serious modeling and all the serious numbers. So I think New York will probably be seen as the epicenter for another 2 or 3 weeks. I would say one thing that I think the global media hasn't realized. New York has all the cases because we're the only ones that are testing. And we have the most functional of the health infrastructures, probably of any of the areas statewide in the U.S., maybe us in California and Massachusetts. So there's a misunderstanding here. This crisis will probably be much worse in other U.S. states. It will just take longer. And two things are driving the perception that it's all New York. One, we're doing the testing, since we're a little more functional than other areas. Two, and this is the big one, our entire global media corps is at home, forced to shelter at home in New York City. So it's what they know and what they can report on. So I think the problem is much bigger and more national and less specific to New York. We're just first.
Well, I would say New York is also the center of such an epidemic because of it's such a metropolitan where the population is much more dense, and there is a lot of international people-to-people exchanges. Let me go to Zhao Hai, our Chinese guest here. The latest information that we were reading, we were paying attention, is a plane load of supply from Shanghai arriving in the United States, bringing masks, ventilators, and all the urgently needed materials to the United States. So what is being done on an international level to help the United States, and what has been China's official attitude towards providing much needed supplies to the United States, and China being probably one of the few countries that are able to manufacture these at a relatively high level at this moment?
Well, first of all, I want to use this opportunity to express solidarity between the Chinese people and American people, and particularly people in New York. And I think you mentioned this first batch of medical supplies just arriving in the United States, and there will be more to come. And China is ready to extend a helping hand to the United States. Chinese government has made it very clear that China will do whatever it can outside Chinese boundaries, borders, to help other countries, including the United States. This has been our policy. However, there's been some confusions from stories that I've heard. There are, for instance, standard problems in the United States because they need strict FDA approval for import of certain medical supplies. And also, there's a problem of supply chain. It's quite difficult to ship things now from China to the United States. And now, because they use chartered planes to move this materials, so things will get faster. So hopefully in the near future, more supplies will move from China to the United States to help people, particularly first-line doctors and first responders, to use this material and reduce the number of infections in the epicenter in New York and also other part of the United States.
All right, let's turn to this dramatic measure that was taken by the U.S. government last week to inject some $2.2 trillion into the economy. It's called the Coronavirus Aid, Relief and Economic Security Act, where some $500 billion will be made available for corporate loans, $350 billion for small, medium-sized enterprises. So, Max, what more details do we know, and what do you expect would be the impact on ordinary households and businesses, especially small businesses? Will it be enough?
Yes, I think we know pretty clearly that it won't be enough. So it's a moving target. It's hard to say how big the hole will be. I think, unfortunately, this stimulus, while good, it's large and it went fast, it targets an attempt to resuscitate all the imbalances and problems that made our economy so particularly vulnerable to this particular issue. So I think it grossly underfunds the medical response, because when it went in, particularly the Republican Party in the U.S. and some others, but were basically still pretending this was going to be smaller and shorter, because that's been one of their strategies. And I think that's sort of unfortunate, too. It doesn't help the states and localities part of the problem here is the federal government's sitting on the money, the states don't have it, and their ability to borrow is limited, and the federal government is not pumping money to the states. I do think we're going to see, between the federal government and the Federal Reserve, which has probably already done over $1 trillion, by the way, worth of stimulus in the last 2 weeks, on the way to doing 4 or 5 trillion potentially in total stimulus, we'll try to prop up the business, but we're watering the plant here from the leaves, not the roots. And it's the roots that are bearing the brunt of it. We can already see that in the United States, coronavirus, at least in New York, is hitting immigrants and lower income working people who are still going to work to keep the society running, and in so doing are getting this virus. And so we are stimulating the less affected areas more than the more affected areas, and that doesn't bode well for the speed of recovery, but certainly it helps, and the faster it begins to arrive, the better.
Sure. Zhao Hai, there have also been some discussion, and people have raised some questions about this kind of a relief package for the Chinese people, for instance, and there are people who are asking question, why not just give some cash handouts to the Chinese, as has been adopted by some other countries? What is your understanding of the Chinese government policy here? Can we expect something like that, or maybe it's a different kind of relief recipe or prescription for the Chinese problem?
I think so, because now the problem is China's facing two punches at the same time. First, because the coronavirus impacts, China has a supply side problem. So China has tried to solve that problem, keeping the virus under control, and try to, after the curve sort of slow down, and try to bring people back to work, reopen factories and services. That's the supply side. And now, because the overseas virus infection is growing dramatically, we have a demand side problem. Outside demand is diminishing, and overall, China has a loss of demand in a very grave way. So now, Chinese government is trying to use new policies to try to bring the demand back up. And I think these new policies are in the pipeline. First of all, China has already using this $1 trillion infrastructure construction plan this year, and in the long run, the total will be $7 trillion. That will be the first batch of stimulus. And in the future, I think China will consider to extend a special bond, issuing a special bond, and also enlarge national deficit, trying to use that as another batch of stimulus, particularly considering the demand side and using that to support people's expenditure to help the economy to recover.
All right. Well, huge topic. Won't have time to go into the details, but at least we get a glimpse of ideas. Many thanks to my guests, Max Wolff joining us from New York, and Zhao Hai on the phone here in China.